Ladies and gentlemen, good afternoon to all of you. I would first like to thank Dr. Kluger for his invitation to take the floor today and to thank also our Finnish and Swiss hosts. As Commissioner for Justice, I'm aware that a prison in which the principle of equivalence of care is not applied cannot ensure justice. Health in prisons is a concern for justice departments as it is for national health services. This is a principle that is rooted in international treaties, frequently referred to by the WHO, and included in many recommendations that are relevant for every EU member state. But it is not always applied in practice, including in the European Union. There is often a lack of integration between health services in the prisons and the care and health support services which operate outside. Continuity of care is particularly important when we are dealing with vulnerable populations, which may be suffering, for instance, from chronic or communicable disease or from mental health issues. Thanks to the work of international organizations like the WHO or the Council of Europe, we know that there is an issue of equality of treatment between the prison environment and the outside world. The EU Fundamental Rights Agency, the FRA, has also played an important role in collecting comparable data regarding the situation in the European Union. Thanks to the FRA report of 2019 on criminal detention conditions, we know that there is a shortage of medical staff within the prison system in every EU member state, including in pre-trial detention facilities, and that there is often a lack of privacy during medical examinations in every member state. It is imperative that international organizations continue this monitoring and surveillance work to inform policymakers. It is also important that prisons are fully integrated in all health reporting systems, so that problems or possible positive experience are properly reported. When it comes to joined-up thinking between justice and health departments, I was glad to see good examples from Portugal and Finland raised at the WHO Sixth Prison Conference. The work of the Council of Europe has also been invaluable over many years, and I would like to take this opportunity to congratulate both organizations for their leadership. When it comes to the policy side, the prison systems of EU member states are exclusively a national competence. But there is a lot the European Union can do to help. For example, we can support the exchange of best practices. We do this, for example, through funding Europris, which brings all EU prison administrations together to share such best practices. We also fund European networks of independent monitoring bodies, such as national preventative mechanisms. These bodies have been vital in providing data on health in prisons, for example, to the FRA. In the past, the Commission has funded the development of a toolkit for prison staff, including, for example, learning material on healthy nutrition. Most recently, in May this year, the research project RISE-VAC was launched with financial support of the Commission. This aims to increase vaccine uptake among the prison population in the European Union. Indeed, the coronavirus pandemic has further underlined how problems in the prison systems, such as overcrowding and the huge number of people in pretrial detention, impact health in prisons. To reduce contamination risks, the use of open regimes in combination with electric monitoring or early release for specific categories of prisoners with low security risk has relieved the burden. We should further encourage best practices. With regards to the pre-trial detainees, they account for between 20 and 30% of the EU prison population. Alternatives to pre-trial detention, such as electronic monitoring or an obligation to report to the police, are not enough used in practice. This contributes to prison overcrowding, and, as the pandemic has underlined, it increases the risk of infection spreading amongst prison populations. But as I said, it is not only justice departments that can contribute to improving health in prisons. In the Commission, we evaluated how funding streams relating to different departments could be used better to help member states to improve the situation in the prisons, including healthcare. For example, the European Regional Development Fund can be used to improve energy efficiency and thereby for the installation of central heating or isolation. This could contribute to improving sanitary conditions in prisons. The European Social Fund can be used to fund training for prison staff as well as inmates. And the EU for Health programme has specific funding for prevention and promotion, as well as for strengthening control of communicable diseases. We also have specific actions on vaccination, prevention of smoking, better nutrition, and mental health, which could equally be applied to prison settings across the continent. The European Union now has the most important budget ever, so there will be many opportunities for member states over the next funding period that can contribute to improving health in prisons. To conclude, the monitoring must continue and the Commission will maintain its support. Thank you for your attention.